Oh, we ran late today.
Yeah, we did. I didn't expect to, but we did.
It flew by though. It went fast.
Yeah.
I want some CDC tacos now, you guys. CDC.
Did we lose Kathleen?
Yeah, she
I
left.
hope not. Gallery view. Here we go. Are we adding our friends, John?
I hear him. I think he's clicking away.
Okay.
Not on view.
Oh, Brian's here. Wow. Antonio. We got some new ones. Our usuals. Kathleen. Awesome. Hi, Madeline. Hi, Lauren. Hi, Sarah.
Hey.
So, what do you think?
We missed our chance at having 3 months on at one time.
Yeah. Where was the other month?
Kathleen.
Oh, I didn't know
That's
she's a month. I didn't see that.
No, that's her maiden name. I said that when I was bringing her
Oh,
on.
I'm sorry, I missed that.
Yeah.
Hi, Giselle. How are you? Thanks for joining.
Yeah, I'm glad I made it. Thanks for coming back.
Yeah, you're in Canada. Is your school year any different than ours?
I think our kids are already out, and yeah, it's like different schools seem to be doing different things, but yeah.
Do they have anything in the news or any
Yay, Canada.
Yeah, yay, Canada, totally.
Yeah. Anything from like government level about kids in schools or any plans they have?
I think they're planning to try and like leave it open. Last I heard, and I'm not a mom. I do have nephews, so I should know. But yeah, that they were leaving it up to families to kind of decide if they felt comfortable with their kids going. So and that they would make a plan possible for homeschooling. So my nephews completed their years homeschooling, and most of the schools in the area did like alternative grads and things like that.
Yeah,
and so I mean, I think they're projecting that they would be continuing as usual in September, as long as things settle down. And our numbers here in my part of Canada have been really really encouraging. I'm in BC, so we've had Dr. Bonnie Henry, who's like, she's had those shoes, designed for her, and she's like was even in the New York Times and stuff. So she's put us on the map. She's been pretty awesome.
Hey, Antonio, nice to see you. So about the I have a question on. So are they leaving it to? I'm sorry. Let me back up. Are your schools based on your provinces, or is it a federalized system where there's stronger federal guidance over oversight of the schooling, or is it more of a stronger provincial oversight?
My understanding is that it's provincial.
Okay.
And but I could be wrong.
So our districts are what really are most influential over our schools. We follow state level guidance, but our school districts are very, very different, even within the same counties. I know that that's not necessarily true in Canada. In the provinces, there's more uniformity, but differences between provinces. So are you seeing any provinces that are, obviously BC is a very, well-run and liberal province. What about Alberta and some of the more conservative provinces? Are they, are you seeing the same kind of crazy that we're seeing here in the US from the more conservative elements?
Similar, I would say a little bit diluted, but definitely yes, in the prairies, in Alberta, for sure, Saskatchewan and Manitoba. It's kind of like your Midwest a little bit, I guess.
Mm-hmm.
Yeah, it's definitely more conservative politically there. I'm not really sure. I don't actually really know how they're running the school systems in those other provinces.
Mm-hmm.
I should probably know more about that than I do, but yeah, it seems as though the hardest hit here have been Quebec for sure. Quebec's been really struggling, and they're interesting politically actually. So yeah, a lot of very conservative values over there politically too. Ontario as well, and yeah, higher numbers, I would say, in those provinces.
The reason I ask, I know that culturally we're brother and sister in some ways, but we're also extremely different. And so the commonality that I've seen is that well, let's leave that aside. What I've seen in the United States is that it has been these what we call non-pharmaceutical interventions have become politicized. So we're seeing that mask usage, and Terry mentioned even like on the far left, the people who are anti-vaccine and all this other stuff, they have taken on the mantle of being anti-mask as well, which puts them as strange bedfellows to the libertarian, alt-right, anti-tyranny, masks are tyranny, government doesn't have a right to tell me what to do or how to live my life, which is all super weird because I don't care what your objection is to wearing a mask in public. I just know that it's stupid. Okay, so if you object to wearing a mask in public, I don't care if you're on the left or on the right. You're stupid, period, to me. And I'm sorry. So that's what it comes down to. If I had a great interaction, well, not a great, but an interesting interaction. This is what I wanted to tell. And probably was appropriate to tell it during the general town hall, but it's fine because I post the post show as well on YouTube. I was sitting in my cardiologist's office a few days ago, and I was of 8 people, and there was they were in a new office. It was spread apart. The seats were also spread apart. Everyone's wearing a mask, and I was one of 8 people in the waiting room, and I had to wait, no problem. Sitting there, I'm going through my phone and Instagram. Actually, it was on Instagram. And this gentleman gets up from across the room and walks over to me and holds his phone up to my face. I was like, what's going on? And he's got his USA and America. It wasn't a MAGA, just USA and hat, and it was a American flag mask on. And he's like, have you seen this? And I read it, and it says, Democrats want to test vaccine on Black and brown people first. Okay, and then I saw the note on, the thing on top is it's from the Patriot Post. Okay, and then on the ad on the bottom is, are you a strong Trump supporter? Right, the flashing like 1986 gifs, right? And so I'm like, how am I going to respond to this guy? And I was like, sir, I don't think that that's true. And then there's, Terry knows the real Sanjay inside of me. He's like, you got to say something, man. And so I, something welled up in me, and I was like, do you really believe that that's true? Why would you believe that that's true? Right. And then he's like, well, why wouldn't it be, And then I'm thinking to myself, well, I'm the only brown guy in the office, right? He didn't walk up to another like rando and hold this thing up to them. He walked up to me because I'm brown, and the thing said, they're coming to test on you, Like, okay, I don't know where this guy's coming from. So then instead of going back to his seat across the room, he goes to the seat right next to me and then scrolls through another thing that he wants to show me, right? Then he brings up the phone to my face again. And everything okay? I'll go find out. Okay. Yeah. I will. Okay, I will. Go put on Chrome on your machine so I can.
No,
okay.
Well, Chrome isn't on, but
it's got to be on. Okay. All right. So it's the post show anyway. So then he pulls up another article, and it's like, I don't know, from some other like total right wing or Steve Bannon funded nonsense, and it's like, what was it? It was something about AOC says defund something else, right? And then he starts muttering about how these guys, they want to defund everything. They want all these criminals be running around, and I can't believe this. And I'm like, okay, hang on, dude. And I turned to him and I was like, sir, I don't know. You know, there's a lot of crazy stuff on the internet, and it's kind of dangerous to believe the first thing that you read without really checking to see whether it's true or not. I mean, like, why do you believe this, right? And he's like, well, why wouldn't I believe it? And I'm like, okay, I'll let this go. So I'm flipping through my Instagram, and then I'm muttering to myself so he can hear. He's like, and I was like, see, sir, this is why I stopped reading that stuff. See what I'm doing? I'm looking at flowers and pretty girls and people on vacation. This is my Instagram account, right? And then and then I let the moments go by again, and I was like, I'm gonna do this little social experiment. So turn him over. So did you hear about the UFO they spotted over Wilkes-Barre? Dead, like deadpan, like, you know, dead serious, you know. And then he's like, what? And I was like, there was a UFO they spotted over Wilkes-Barre last night. Again, this face, okay? And he's like, really? I'm like, no. You see how fast you believed me? Did you see how fast you believed me? Okay? Did I make my point? Okay? You just can't. This is what's killing the entire country. People like you will believe this, and you get angry and you get upset over lies. Okay? And it's dangerous. It's very, very dangerous. And you're getting nothing out of this transaction. Okay? Because they are getting everything. You click on the next link that bothers you, okay, that angers you, and some guy just made 0.26 cents off of you clicking on it. There's hundreds of thousands of you doing it every day on hundreds of thousands of pages. And you know how much money you're getting? Nothing. The guy who's putting this stuff up, he's collecting it every day. He's going to the bank and laughing that you believe all of these lies. All right? Now, I'm not making this up. Like, there's no reason for me to make this up. In fact, in my wildest dreams, I could not have made this up, that a man wearing a American flag mask with, you know, hair growing out of his ears and a fake vet hat comes over, trundling over to me and going, they're about to vaccinate brown people and black people, Democrats are. I mean, I couldn't make that shit up, right? So it happened to me in my cardiologist's office, and it was awful. And then the next thing is the lie about AOC and defunding. And can you imagine? This is happening to hundreds of thousands, millions of people every day. Their blood pressure, they're getting incensed over these lies, okay? And that's the political stuff. Now, what about the anti-science stuff? What about masks or tyranny? What about the Democrats are using this to control the, to get the election in their favor? That the coronavirus is going to go away the day after the Democrats win, okay? This is all scrolling past these people who can't stop for 0.26 seconds and think, wow, there's probably no way there was a UFO over Wilkes-Barre yesterday.
Hey, Sanjay.
What?
In that local group that I moderate, I asked them to only put up a source that wasn't a news site. So they posted a YouTube video by a Dr. Barkey in California, I guess, and said that was their expert. So I looked at it for about a minute and a half, and I came back and I said, he has a riveting take on chemtrails. And I was done with him.
Yeah.
I tell people that COVID, when you breathe it out, it's a chemtrail, so you can't walk in somebody else's path. And we should just tell them, well, it's chemtrails. You got to wear your mask or you're going to get chemtrails.
Yeah, I mean, they've made jokes about wear a mask. The government is trying to use facial recognition to, you know, put 5G in the vaccine. If they don't have your face, you know, they can't do it or whatever. Just insanity. We started this town hall, John and I, to fight insanity, right? It started with the pandemic thing, okay? It started with pandemic. And I think we were 2 weeks into it and pandemic came out. And then John was like, I'm getting involved. I'm going to start producing it. And Terry's been with us since day one. Every single one, he's been there. And then Karen joined, and now we have like a team around this, and I do all the backgrounding and the reading of the papers and stuff like that. And I know that this has helped a lot of people. I know that because the little video that we did, I think week 3, of me putting on a mask and telling people how to put it on properly and make sure that it goes up in our, it's gotten like 27,000 views, right? And and even if that is that minimally helpful that we've done, that's the least impact we've had, I'm happy. But the sad thing for me is actually we've been far, 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 far more impactful. People have reached out and said, I have this problem, I can't get this test, my kid's 11 months old and tested positive, I'm 33 years old and I had this in February, I'm still not feeling well, I have a racing heart, what should I do? Okay, I can't walk up a flight of stairs. Now I have to, over the internet, and again, I'm not giving medical advice, okay? This is not me treating anyone through the internet. This is not telemedicine. This is me as an advocate for those who are reaching out to me, to them. I'm being an advocate and saying, you need to go and get an echocardiogram because you might have cardiomyopathy. No one told you this because medical community doesn't know about it yet. Okay, so it's us in the biomedical community reading and researching 8 hours a day and disseminating best practices and evidence. And then I get stymied. I run into an area where I don't know enough. I like psychiatry. So I bring on JJ, okay, or psychology and psychiatry. Or I run into another brick wall, like what do we do with schools and kids? And so this is the next thing we have to tackle, you know. And but I'm using this as a point. I shouldn't have to be doing this.
Oh, you shouldn't.
Okay. This is the 9-page strategic plan for COVID research from our National Institutes of Health. 9 fucking pages is our strategic plan for 2020 through 2024. That's the best they could do. And it's all dribble, improve fundamental knowledge, support development of diagnostics and assays. This, I mean, I'm sorry to say, but this under a Democrat would be 800 pages and detailed beyond belief, because that's how government is supposed to run. You're supposed to, God is in the details. It's about policy impact. It's about expertise. It's about funding research. There's nothing in here about kids. There's nothing in here about schools. There's nothing here about air transport. There's nothing here about anything. Track and trace, quarantine best practices. You know, what happened to the U.S. government? Where'd they go?
I don't know. We all paid our taxes.
And the strategic, yeah, exactly. We did, didn't we? Yeah. And here's a strategic plan on testing that I keep showing you guys that no one is doing. No one is paying attention to. No one in the country. And that's why we've got 70,000 new cases a day down in the South. We should not be here. We should not be here. This is 6 months into this thing. We're doing this for 17 weeks.
We're not doing half the testing we need to be doing nationwide.
Not at the pace that we need to be doing it. If you're not getting your
Or you
results
can't
within
even
24
get
hours, your
tested.
test is useless. At this point, if you're not getting your test result, let's say you get tested on a Monday. If you don't have your test result by Wednesday morning, it's not fast enough.
I thought that by now there would at least be people really getting it together.
Yeah, me too.
You know, I thought, okay, March, April, we stumbled, but we're America, you know, goodness will prevail. And yeah.
I think goodness is actively being suppressed. Like,
I do too.
like
Absolutely.
it lit my blood on fire. I'm sure Terry knows. It lit my blood on fire when I saw them go after Fauci. When they started doing, you know.
Did you watch his He did a town hall today and I missed it. Did anyone see it?
No, I didn't.
I saw about 2 seconds, and he was prattling on about, Biden's plan. It had nothing to do with anything that I
Okay.
wanted to hear. And I clicked off because I get a rash if I hear him for more than 5 seconds. I break out. So.
Oh my God. So Madeline and Catherine, any questions? You guys always have interesting stuff for me.
I sent you an email about a question whether or not G6PD was responsible for the increase in severity of COVID and deaths in Blacks.
Yeah, it could be. There's an association. In fact, I have a paper on that. It could be, but I think really it could be, definitely, because of red cell fragility, its effect on red cells, and ferritin, and all of the so G6PD for everyone else that's here. Glucose 6 phosphorylase deficiency, it causes red blood cells to break apart more easily, okay? And when you have a very highly inflamed microvasculature in the lungs and elsewhere in the body, the red blood cells are bumping up against a lot more stuff physically, and they can't repair themselves, or they can't sustain that kind of level of abrasion. And so they break apart, and ferritin levels go through the roof. This is higher prevalence, it's genetic, and it's in higher prevalence in Black people, okay? So not all Black people have G6PD, but a lot more Black people have G6PD, the deficiency, than white people. So I think Madeline was asking me, and correct me, Madeline, if I misunderstood, she's asking me, could that be one of the reasons we're seeing more severity in Black people, that there's a higher prevalence of G6P deficiency? I would say it is part of it, but I think the worst severity that we're seeing in Black people is most likely socioeconomic determinants of health, like greater hypertension, greater obesity, and long-standing undiagnosed vascular disorders than just the G6PD. But I think what we will see is if we reopen the schools in predominantly Black districts and neighborhoods, or schools that are predominantly Black, and you have kids in those populations that are definitively higher carriers of the G6PD, the deficiency, those kids will probably do worse, even without those other comorbidities. So that's a good question. Yeah. Anything that is going to, anything genetic that leads to fragility of red cells, or even genetic disorders in some populations, Jewish populations with other blood dyscrasias, they're going to do poorly.
The other thing I wanted to ask you about, if this is happening in other hospitals, this is one of those ain't it awful anecdotes that occurred to a young friend of ours. She's in her 30s, a type 1 insulin dependent brittle diabetic who was admitted with fever and primarily abdominal pain to rule out COVID. She was put on the COVID ward. It took more than 2 days for the test to come back. It was on the third day it finally came back negative. She was on the ward. Yes, in a hospital. She had to sign a paper stating that they would not take care of her any comorbidities. They were there only for COVID. Anything else she had to take care of. So she's a brittle diabetic. She had to take care of her own diabetes. She called her husband. They had to call her husband to bring in her insulin. They wouldn't even get it from the pharmacy. Is that happening anywhere else? Have you heard of it?
Which state? Where are you? Where was this?
In Ohio. And it's the hospital that my internist admits to. So I'm packing a to-go bag with all of my medications just in case.
I'll drive out to get you and bring you to Geisinger.
Thanks.
Hello.
No, because actually in Pennsylvania, I heard my very closest friend of mine, who's a nurse who travels between Geisinger and a hospital, UPMC in Harrisburg. She noted that Geisinger's standards are much higher. They had an original average of 6 hours a couple of weeks ago for their turnaround for the COVID test for inpatient admissions, but now they're aiming for 2 hours. And down at the UPMC center, they're around 4 right now. So Pennsylvania, for whatever reasons, and I think it is, to be honest, our strong Dr. Dr. Levine, who's been pushing for quality and safety standards around COVID. So it's not just, basic standardization of admission and what would you call it? The admission standards and diagnostic standards. It's even the patient journey standards are being addressed in Pennsylvania at the state level. So everybody's got to comply, otherwise, they're gonna get hell. So that's great, and I think that we need that because you can't have some systems, like you said, that's awful. That's criminal.
I thought it was malpractice, but
yeah,
anyway,
that's negligence.
Yes. And when they found out she was negative, her diabetes was so out of control, she was admitted to the medical ward for the rest of the day because they had to get her diabetes back under control. It was insane.
Yeah.
Yeah. Yeah. Yeah. And it's a good family friend, so
yeah,
I don't doubt the story. Yeah.
I say this often to be disparaging, but I also say this with a grain of fear around the truth of it. I fear for those who live in some parts of the South, because I know that they are 20 years behind the rest of the country in their level of standard of care.
Mm-hmm.
I mean, I really fear for them.
Well, not only that, there are no family members there or family friends to advocate.
None. Yep.
And that's insane. That one nurse had spoken out and it was not verifiable, but it looked legit to me. And she was in a hospital in the Bronx and she was saying that the residents were making mistakes and other nurses were making mistakes. And I never heard from her again. I was trying to look, did they quietly dispose of her or what?
My niece is a fellow now. She did her internal medicine in Chicago at Rush. Now moved to Boston and is going to start there, I think, GI training. But she was reminding me and others, other people who have just finished their residencies have been saying there's going to be there is today a brand new crop of medical graduates that have just joined their residency programs in the South.
They graduated from Zoom.
Yeah, literally. Their last 3 months of medical school were on Zoom, okay? And now they've been thrown into the hot water. They're boiling fresh meat. That's what we call them, okay? They just finished med school a couple of months ago, and now they're in the midst of a pandemic down in the South.
Right.
These are 24-year-old kids, by the way.
Yeah.
And there's no, go get a supervisor before you do that. There's no one around, or they're fried.
They're going to burn through these kids. They're going to burn through them.
But their supervisors are already burned.
Yeah.
Training
in university hospitals, I would not want to be admitted right now. No way.
This is why I feel very strongly like, the tide of stupid, as you were referring to it, Sanjay, how it becomes so much more important, I feel, like to understand how to respond to, let's call it ignorance. Let's be kind and refer to it as ignorance. I've been processing a little bit around that. I don't want to hijack the conversation, but I did want to
go ahead. Yeah.
To psychological factors that I think are at play in people who eschew mask wearing, who feel threatened by that. And you saw my little Facebook exchange there that I had, and I don't know if you read the whole thing because it was a bit long, but basically just to share with everyone else, I I've been trying to be extremely patient with everyone. I've had a number of like conspiritualist hippie type people who are like seriously nice people, smart people, like people that I like, people that I've like gone to parties with, and you know,
Yeah.
kind of people. And it's been really surprising to see how many have been anti-mask and anti-prevention measures, and really like very very suckered in by the pandemic film and that whole kind of way of thinking of things. And it's been just like, what? And so today I lost a little, or yesterday I lost a little bit of patience, and I posted something saying, you know, for anyone that's, you know, in this place where they're anti-mask and you know, like please check yourself, because I posted a story about the 30-year-old guy that had attended a COVID party in the States, that you know, the poor young man who has been swept along with this tide of denial, you know, and thinks he's all robust, and with a lot of bravado, all these other young people attended a COVID party, and then on his deathbed, you know, admitted to having made a mistake. How sad is that? So I posted a story about that because I've had all these people in my Facebook feed, and out of a lack of patience said, please check yourself if you're one of those people that are, you know, thinking that COVID is a hoax, or something like that. And please check that. And also, because the other thing that I've been hearing about is people saying, oh, it's only the elderly, it's only people with disabilities that are at risk anyway. You know, that's the other way that people in my part of the world here are minimizing risk, which I was feeling kind of impassioned, and I said something about please check that, and the Nazi era eugenics type ethic around that. Like, these lives aren't worth as much as these other lives, and heck, we could include like people of color, Black people with this particular gene fragility that you're talking about that affects the red blood cells, and other people of colors, you know, who might be impacted by something like that, or by socioeconomic adversity, and you know, be lacking access to healthcare and you know, measures that other people in the population might enjoy privilege in that sense. So it's been getting to me, and unfortunately I guess my words were a bit too inflammatory, and it was an interesting exchange with a woman who took offense to my referencing the Nazi era eugenics ethic, because she's the child of Holocaust survivors. And you know, I kind of like didn't even get really what had happened there. She decided to unfriend me because she found my words incredibly inflammatory. But I think what, like, it made me think that I think one of the things that's going on when people are so highly reactive is that it's trauma. And it made me sort of think about how, wow, like, because her charge, she wanted to unfriend me because I don't question the standard advice or whatever. I can't remember how she called it, but I'm not questioning the dominant narrative. And so I'm just parroting the dominant narrative, and therefore I'm a sheeple. And you know, so there's that. And what I got about it was that maybe for her, it's actually dangerous not to question the, you know, the dominant narrative so much, because look at our governments, look at our history, right? We've got broken trust between you know, our governments and our citizens, like going way back. So there's that. And I think that probably the stress hormones that people are under, and whatever like epigenetic unresolved stuff might exist around these themes, are really in the way, and people are just defaulting to you know, there's this subconscious unresolved trauma that is present, I think, and really shutting down people's capacities to really you know, take that pause and have that patience. You know, your little story, Sanjay, about the gentleman in the waiting room.
Yeah.
Like, I'm so curious about what happened after that, and how he responded to that exchange, because I feel like I'm starting to develop more compassion for people in that place, right? That it's like alarm bells, and that maybe like being calm and gentle is a way to handle that and respond.
Yes, I would agree with your last statement. So I'll go backwards through what you just said. Okay, so I would agree that I think the ideal form of dealing with them, and it's hard for me, and Terry knows this, it's hard for me to start off with gentleness. Okay, I also get inflamed and enraged, and I just sometimes can't see past the ignorance and towards the internal reasons for that ignorance, or the trauma that might lead to the defensiveness that keeps them from the defensiveness that keeps them from exploring towards a more holistic view, or a deeper understanding of where their ignorance is based in, so let's go, going backwards through your statements. That's the one thing. Gentleness is hard for me. But then by the end of our conversation, which wasn't really a conversation, I just left it at that. I just really literally showed him my Instagram. I said, look, this is what I do. If I have to pass the time, I look at what my friends on Facebook have cooked. I look at their kids' pictures because they have beautiful kids. I look at their dogs and their flowers and pretty girls, and I have lots of women friends that are beautiful, and I'm just like scrolling through and trying to make them happy, right? And I finally get a smile across the face, and I'm like, look, you can't. It's really destroying everyone inside, and it's destroying the country to just blindly believe stuff, okay? Because you're gonna hate someone that you've never met. You're gonna be upset over something that's not true. And when you got lots of people like that, the country just gets really, really angry and sad. And that's why I stopped reading that stuff. And I just kind of smiled at them and let it go, right? And we have masks on, so you can't even see me smile.
Right.
Okay. And so the thing for me was that I don't think he expected my response. I think he had a stereotype of me in his head, and I could see it in his eyes. The mild-mannered brown guy that'll just look at this and be shocked and feel fearful that the Democrats are coming for me, and they're going to be the one. I'm going to have to go and get vaccinated. They're going to forcibly vaccinate all the blacks and browns first. He, in his head, honestly thought that my reaction was going to be fear. Okay? When it wasn't fear, I think he was shocked. Okay? And when he shows me the second thing on AOC, and I'm like, do you really believe that? Do you really believe everything that you're reading? Do you understand why it's being written like that? I'm sure I didn't say all those things, but in my sentiment to him, I did kind of convey what my disdain was for it. Okay. And I don't think he was ready for that. I think he really honestly thought I would be malleable and compliant with his perspective, that I would just look at it and go, wow, thanks for showing me that.
Hey, Sanjay?
Huh?
I realize now, listen to you, both of you, that where I'm screwing up is I need to stop going, hey, you whacknut crazy fuck, get away from me. And I might have a better person-to-person contact with them.
True, Terry.
Yeah.
True.
It's a revelation to me, that's all.
Now, by contrast, if that guy had done that on my FB page, I think you all know what he would have suffered, right? Right? Yeah. Yeah.
You're bringing up a valuable point, though, and I just want to say one more thing about that. So one of the things that's happening in my town, I've been putting together a little group on the weekends just to talk about like white privilege and unintentional replication of racism and the impacts of that. And so I've been trying to soak up some work out there and learn, and share that with other people. And one of the things, there was a woman named Molly Murphy on Salt Spring Island, one of the Gulf Islands in my area, who wrote a wonderful piece about a new zine called The Saltine. So I really want to credit her because she wrote a great piece on this. She talked about how about how white people can address, and this is a different topic, but I think we can translate some of this, about how white people can address racism when we see it. And you know, very often there's a lot of natural emotions that emerge, and we want to like come on really strong, and that's really understandable. But she said, please don't do that. Please check yourselves, work with your nervous systems, do what you have to do essentially to be kind, to be respectful, and still make your point, but to do that in a way that doesn't shame someone, you know, that kind of allows people to have their dignity, and where you can.
You lost Giselle.
Yeah.
You lost Giselle for a moment.
Them calm and settled, and like it sounds like you did, Sanjay, in that waiting room exchange. Because if we don't, and if we go in hot and hard like that, it causes an escalation in the other person and a locked.
It's that famous British Columbia internet. It has to bounce off satellites to get to us. We'll wait for her to resync here. So that was the one story, and I had, oh yes, I went for a haircut. So I got my haircut and I felt great, and I saw the lady who's cut 3 generations of Adoshi hair. So she cut my dad's for years, and then me, and then my 2 boys. And you know, she's an old school hippie. You know, she's a wonderful lady, and you know, they had to shut down and all this other stuff. She noticed the same thing that I noticed, though, and she was very surprised that our area. Sorry, Giselle, we lost you. We'll catch up in a second. We went on, but we'll catch up in a second. And we were talking about, I just got a haircut, and the lady who's an old school hippie who's cut 3 generations of Fudoshi hair, my dad, myself, and my boys. We're catching up about how we're very proud of our area. I'm very surprised that Pennsylvanians in Northeast PA, who are generally, I mean, we're a redneck area of PA, let's admit it. We're a redneck area. We're not as redneck as central PA, but this is a community of coal miners and deer hunters and you know, go out on quads mudding and pickup trucks. And we're proud of being Pennsylvania mountain people up here. But we're all really kind to each other. Okay, we're all really generous and gentle people. That doesn't matter. Like, they've seen Indian doctors' families move in here from New York and New Jersey. They've seen Korean doctors and business people, and they've seen a lot of Latino Americans come from all over the place to settle in our county and the 2 counties adjacent. And they've actually, very few of them have had any negative reaction. They've all been very welcoming. The original communities of the Irish, the Polish, the Italians, mostly, you know, white communities, Catholic especially, but also a lot of Protestants. And it's just, I don't know what it is about us here. We're good to each other. We don't have big racial problems or big, you know, problems with integration, or I grew up here, and I can count the number of times I've felt racism in my area on one hand. And so with this masks and with disinformation, I think there has been a very low penetrance of disinformation and anti-science sentiment or anti-whatever, anti-intellectual sentiment in our area. And I don't know whether my surprise is merited, because growing up here, I've known that they are, I think they were more blue-collar liberals, union liberals here, and that has been on the decline, which led to them switching over recently and having voted for Trump in the last election. It was very sad for me to see my area do that. But having said all of that, and knowing the longer history of 30 years of this area, everyone is masked. Everyone. Now I've been out. Okay, so I've been out to the usual haunts, which is groceries and haircuts and bank and big box stores like Target and Marshalls and wherever. Just I've been out enough to see 95+% compliance. I think people that I did see without a mask either forgot it in their car, or they were just wait, I have to go get my mask. They were just conscious of the fact that they didn't have it. The golfer that walked into the convenience store down the street here, and the three of us are waiting in line, he didn't have his mask on, and he felt it, he knew, ran back out to so I would rather it that way than the other way, than three guys in line without a mask and I come in with a mask. You know what I mean? But I see a lot of Americans and a lot of people who message me saying that this is what they're seeing. I had my mask on, but nobody else seemed to care. And that's why we see the numbers that we see right now. But
I'm wondering what's
Go
going to
ahead.
happen in very rural areas in North America. I am in the Rocky Mountains, but I'm in a
Yes.
resort area.
Yes.
So people here are very well educated. They're wealthy.
Mhm.
The visitors are wealthy. They're well educated. There are quite a few from Texas who don't like wearing masks, but in general, the visitors also get kind of the evil eye from the locals, and so they're complying.
Good.
But there are other areas. I had a friend, this is a different area, this was rural Wisconsin. And we dated for a while. This is probably about 15 years ago. He was an oncologist, and he had an extremely difficult time explaining to his patients what was going on within them, what was going on with their health.
Mhm.
So kind of beyond politics, this is before politics, before misinformation and things, there was just a kind of an ability to really understand the concept of medically what was going to be happening to them, which is sort of similar with the coronavirus turning into COVID and what the real dangers are. And now that I'm up in the Rocky Mountains, I feel that it's the same thing in extremely rural communities. Most people get like, we'll listen to NPR, which is good on the radio. But there are people who, it's not like they're trying to be in your face politically, but they actually really don't understand medically what is happening.
Okay, I want to cover that. I'm going to hold right there because I want to finish up with Giselle. But I want to hold right there because that brings me back to something that Terry said last week. That put the gears in my head turning around. Is this hard to understand? Okay, so let's go back to that in a minute. But Giselle, let's finish up what you were saying.
Sure. I guess I just wanted to say that the point that Molly Murphy was making was, please be kind, because when you're not kind and when you come on with an equal assault for someone, and psychologically this makes a lot of sense, that people lock in, they ramp up, and it's there's no connection or openness that's possible. Stress hormones take over and everything shuts down and goes to reptilian brain.
Right.
And, in what Molly was referring to is that when that happens, those people are going to go ahead and replicate systemic violence. They're going to be more violent. They're going to take out their aggression that they maybe don't feel like they can really succeed at expressing with you. And they're going to project that aggression onto people of color. BIPOC people. So that's what her caution was on that. And I think that's true. And I think that could also be something that happens here with people locking down on their anti-mask positions here. And meaning that it's going to add more like fuel to the fire that potentially I think that could be the case. So for me, and maybe this is going to be different for other people, but I think the more that I can feel calmer and understand, oh my God, that person's really in fear, maybe there would be a different possible conversation, involved, that wouldn't involve them feeling like they need to escalate their position or convince me or take that.
Yeah, I think that's part of it. I think that some people are convinced that, and this is something that I think we have, at least I have felt like I've evolved beyond, is that I don't argue for the sake of convincing someone
Right.
anymore, because that will result in an extreme level of disappointment. I've been there, okay? An extreme level of disappointment and frustration when you feel like this should be easy to understand. And then that person has all their walls up and all their guard up and all of their weapons of contrarianism up against you. So you don't know how many layers you're going to have to fight through. And it's likely that those layers are insurmountable. It's very hard to convince people in this era and through these medium to let go of their falsely held convictions. And they would more readily use their amygdala than their cerebellum, okay? Cerebrum. So the thing is that there's an extreme level of defensiveness, there's an extreme level of prejudice. And I'm not talking about racial prejudice, I'm talking about the kind of prejudice towards a alternative view, an oppositional view, a contrary view of any kind. And we're all guilty of it. Whether you're a hardcore liberal, lefty, progressive, or on the other side, we are now so polarized that we both exhibit the same kinds of behaviors when we're defending our convictions and principles. So I think that goes to what you said, Giselle, in the midst of it all, is the ability to let your guard down and be less aggressive, both in response to people who have that kind of, response to you, to show kindness first. That empathetic response, I've gone through these exercises with JJ, which is kind of like, why do you feel that way? Can you help me understand a little bit about what, drives your thinking on that? Did something happen to you personally that could explain, your view? Okay. Those are the kind of questions we don't ask each other. We go straight to Terry Munt levels of and I'm guilty of it more than him, by the way, so I got to say that. But yeah,
you do it online and I do it to their faces.
I do it too. I mean, but you're right. And do I foresee a more gentle era evolving? Actually, I do. Terry doesn't, but I do. And I think it's because I see it in my kids.
Mm-hmm.
Yeah. With us, forget it. We're gone. We're
30 years ago, when there was a whack nut, it was kind of secluded by their beliefs.
Yes.
You know what I mean?
Yes.
You lost touch with your relatives. All your friends found something else to do. Right. And you sat in your basement cleaning your gun. Now that it's a political ideology, it's different.
Yeah.
And my answer to that is to say, hey, you're a fucking wingnut.
Yes.
And then I block them.
Yeah.
Because I don't want to interact with them. Because it's moronic. I'm not going to argue their stupidity. And I don't see a meeting of the minds with a fucking moron.
Yeah, I mean, it's easy. It's actually easier. It's not easier necessarily, but it's definitely better to back away when you sense a kind of an extremely low level thinking and high level resistance. Okay, so when the thought process that derives their principles and conviction are this low and base, there's no point in engagement. There's no point at all. Okay.
There's nothing's going to happen. It's not going to be resolved. There's not going to be a meeting of the minds. And all you're going to do is have an upset stomach.
Yeah. Our friend.
I enjoy doing it.
Yeah, I'm sure, and I do too. At times I call it blood sport. At times it's a cathartic, right? Yeah, you've seen that, right? So, but for Terry, I want you to cover again what were the three types of mask objections. It's either political or it's the
Ignorance.
ignorance, right? Because
And we can lap that in with the anti-vax.
there we go. Okay.
Yeah.
So let's go to the ignorance part of it. Let's leave aside the political because the ignorance part of it is really surprising me. Okay. So I can understand. I love him. So the ignorance part is surprising because Catherine brought it up, which is a lot. Is it hard to understand? The second or third slide that I covered today, which was distancing, the math of distancing. Okay, at R naught levels, at R effective 50 and R effective 75 levels, and
Pressure's on, Sanjay. They want you to do something.
Yeah, I know. So at those levels, okay, that might be a little complex, okay, but the mask thing on the same slide should not be complex, okay. Now, ignorance 5 months into a pandemic is startling to me. Okay, it's startling. And then lack of
an example.
They'd have to conceptualize what's going to happen to them, and they can't because it's going to happen to somebody else.
In March, it was March or April when Trump did his hydroxychloroquine thing. Sorry about the H word, everyone.
John isn't here. Thank you.
Yeah, okay, I'm safe. Someone took a aquarium cleaner that had the similar sounding name.
Yes.
And him and his wife took it.
Yeah.
And one died and one ended up hospitalized.
Yeah.
That explains the dumb.
Right, it does.
There's a lot of dumb out there.
Yeah.
I have a theory.
So, okay, go ahead.
My pre-COVID theory about this type of voting against your
interest,
your benefit.
Yeah.
I think there's an undiscovered microorganism that's similar to toxoplasmosis, where it makes mice seek cats out and like them, so they'll eat them, and then the microbe can.
I heard
survive.
of that. Yes.
Yeah, I think it's that. That explains the numbers, the sheer numbers, the people you think are otherwise cool, and all of a sudden they take a hard left, and you're like, what? Where'd you go? I think it's that.
I have a
slugs for salt. Slugs.
Why is it more in the United States than other countries?
Why is it I think just our societies like that. That's part of the rugged individualism. I think that
we fluoridate the water.
I'm uneducated.
It's neurotoxins.
But I think there's some of us that, I mean, not some of us, but there's some Americans that are proud of not being quote unquote overly educated.
Yes, exactly.
Right.
Okay. And so,
but there are others that don't even know that they are not educated.
Yes, they believe that they are. They believe that they are.
No, but they don't. They just don't really think about it.
Oh, okay. Okay. Well, I've come across the people that believe more often than not. I come across the people that believe that they are.
That's more CEOs and people like that with big egos who feel entitled.
Yeah, I do. Yeah, I do come across them more than.
So it's willfully ignorant and just plain old garden variety.
Ignorant. Right.
Those are the two. So the question I had in my head tied the three things together, which was, which is the most dangerous though? I always thought political apathy is very dangerous, right? Like, I don't care about politics. I don't vote. It doesn't affect me. I've always thought that that's dangerous long before Trump. Okay. I thought it was dangerous in 2000 when I first saw it. Okay. After the Clinton era and the whole Bush Supreme Court debacle, and that was just the beginning of how dangerous political apathy could be. Now we have a different kind of willful ignorance and I think that willful ignorance is different than general ignorance. Okay, general ignorance is I don't really need to know about this. It doesn't affect my life, right? And then willful ignorance is I believe is it no I'm asking is willful ignorance I believe this over that, okay, even though evidence has been provided that I'm wrong.
Yeah, I think that's
Well,
exactly
that would
it.
be, I think that would be the GOP right now. And it's what you said, where they take pride in not showing a high level of intelligence. And that's why people
Yeah.
believe
Remember,
the
I'm sorry,
whole, yeah, go ahead.
the Flat Earth Society said that they had members all over the globe.
Right.
Right?
Yeah.
I think it personally is about nervous systems and people gravitating, that it's not so much about intellect and what people know cognitively. It's what feels safest is what I think it's about, Sanjay. And I think
Feelings.
Good
people
point.
gravitate
That's a
towards
good point. That's a very good point, because for
personality.
me, I feel I would feel extremely unsafe at a Trump rally, but there are 30 million people that gravitate towards those places because that's where they feel safest.
Because they're on the same team. They
Yeah.
feel the unity, they feel
Yeah.
loved. You
Yeah.
know, it's like people being a member of a gang.
Yeah,
Right.
and like
Correct.
and like they're with the top dog, which feels safest,
Yes.
right? Because the system isn't safe, right? Everybody feels that, I think, on some fundamental level about the way that society is organized.
Yeah.
And so, siding with the top dog, there's something very comforting about someone that puts out an aura of confidence and certainty. And so, in an uncertain situation, there's
Yes.
like, that's the sheeple principle right there, I think, is that people want to gravitate to that.
I think you nailed it. That's pretty much, yep. And then we saw, I think I saw a lot of that. It doesn't, and it's not a purely on the right thing. It isn't. I think I saw a lot of it in the Bernie movement. Okay. I saw a lot of it even in the early Obama movement. Okay. Where there was nothing they could say that was wrong. Nothing. Okay. And even the Hillary supporters last time, it didn't matter. We as a society gravitate towards these cults of personality, I think, much more so than other societies. I don't think the Germans will do it for another 1,000 years. They just learned, they learned how horribly devastating it could be. And now even the thought of a cult of personality in their society is anathema. It makes
And now we've got Kanye stepping up
yeah,
to the
right.
plate.
Yes.
Oh.
No, but yeah,
and-
that just follows suit. Okay. So as a society, I think we dangerously are trending towards having a susceptibility for cults of personality.
Absolutely.
Especially in the last 50 years. Yeah.
I've been trying to think about, like, is there a way that because people that study psychology, personality, all of these things, like there's means by which we could actually do assessments. I've been thinking that should be happening on police forces, that there should be screening, there should be like 4-year degrees at least, there should be psychological screening to tell like who's sociopathic, who's narcissistic, and how do we make sure that the wrong people are getting into those positions.
How do they react in stressful
Can you?
situations?
Yes, and I would have to. God, I never thought of it that way. That's such an excellent idea.
They
And
already
they should be
they
recertified.
already do test them on stress.
For our RNs, our registered nurses, especially the ones that end up in the critical care and the really hard work that nurses do, and not all RNs end up doing equal work, just like not all doctors do equal work. Okay, but our Marine Corps nurses, they seek those 4-year. They seek the hardest training they can get, both academically and otherwise. Okay, and it's that cream that rises. It's not the case with police officers at all. At all. And for God's sake, what we're hearing from some of the best of them is that you're asking us to do everything. We're out there solving domestic, disputes. We're we're feeding kids when they're hungry. We're, you know, taking care of animals when they're abused and left out in yards. We're doing social work. We're doing policing. We're doing, you know, and some of the best of them are like, we're not trained for this. We're not paid for it, first of all, and that's fine. But we're out there trying to protect. I'm talking about the best of them, because I always try for, you know, looking at positive deviance. The best of them are like, we're not trained for this. We didn't go to four-year college. We don't know psychology. We don't know all this stuff. Like you were just mentioning, Zell, you know? And
One thing,
go ahead.
in St. Petersburg, Florida, they just announced a program where they're going to take those types of duties away from the police,
Yeah.
hire social workers. This is in Florida.
Yeah.
And the immediate response is everybody saying, oh my God, you're going to see a social worker
Yeah, I
walk
saw
into
that.
a domestic dispute
Yeah.
and death.
Yeah.
And I said, what part of nonviolent do you not understand?
Right. Exactly.
Domestic violence. Violence is right in their word.
Exactly. Yeah. Yeah.
But I probably should have been kinder when I responded.
It can be done. It can be done, but
It has been done. They've shown studies where it's been done and it's
Yeah.
been successful.
I was shaking my head about being kinder. So
I think
I've
one of the
lost
things,
my
one of the fascinating, because I have to have that context of the hospital environment, I guess. One of the fascinating things I saw was getting an independent, completely independent. I'm talking they're embedded, but they don't report to the same managers. They're not within the same payment structure. They're completely independent. We call them patient navigators. Okay. And what they do is they're assigned to your patient, especially complex patients, as soon as they walk in for an admission. And they are there to make sure that every protocol is followed by every caregiver. And it's not like internal affairs cops. Hi, Leslie. I love seeing her face every week. And it's not like internal affairs cops, okay? They're actually there to both help the patient and help the staff. They're there to help dot every I that's missed and cross every T that's missed, which happens when you're dealing with a very high flow environment, and caregivers do need that. Caregivers are getting something called fatigue alert. Alert fatigue and things like that, where the computer is delivering your next steps, cookbook medicine. Do this, do this, do this. Did you do this? Did you notice this? Did you, this patient's drug is interfering with the multivitamin. Are you sure you want to give it? And you just want to slap the computer screen and say, I know, just shut up. Let me do my work, right? And so we have all these so-called artificial attention destroyers. And then then a human comes along and says, Mrs. Jones just wants to know, is it okay if she does this right before she gets scheduled for that, and that human touch is brought in because the patient doesn't know how to advocate for themselves, doesn't know how to speak, or is afraid to speak on their own behalf. Okay. So they're not staff, they're not caregivers. Okay. And their job, they're known, that they've been told your job is to help the patient and the caregiver equally, and make sure that their patient journey adheres to the best possible course. Like you've got the compass, you're the navigator. Get this patient to the other end of this process safely, and et cetera. I think we probably need to embed such people with police officers.
Yes, I would agree, and have like undercover officers because like we know that there have been white supremacists infiltrating forces, right? And so putting undercover officers that are there specifically to, check it out and see what's going on. I think that would be a really good idea too.
Yeah.
And just leadership, I was thinking, like, I don't even know how we would get there from here, but I was just thinking about, like, when you think about who gravitates to leadership positions in government, here too in Canada, I mean, Trudeau's labeled a liberal, right? That's the name of his party, and he's not a liberal, right? Like, it's he's very conservative, and I mean, he is certainly more liberal than, you know, outwardly than Harper, his predecessor.
He's considered a communist in Texas. He's a Stalinist communist in Texas.
Hard line.
Yeah, oh, wow.
But he has oil, so they like him anyway.
Yeah. Oh, my friends, it's 11. I love you all.
Wow.
We're gonna call it. Okay.
Yep.
All right.
Thank
We'll
you.
see you next week. Submit
Thanks, everyone.
topics and things for
Bye.
next week when you can. Okay. Thanks
Okay.
for joining.
Take care.
Take care. See you. Bye.
Good night, all.
Bye.
Good night.